And now that we're up and running and settling into this new reality, we're changing up the format a little bit for access to insights. We want to make things a little bit more interactive and engaging. So first of all, after Cindy speaks, we're hopefully going to have a JCF News roundup from our CEO, Beth Cyril. We're in a very privileged place in the community, but we're also the hub for a lot of information where, you know, a lot of information comes to us, and we wanted to share some of our findings and learnings with you. So after our interview with Cindy, you can look forward to this update from Beth. We are having a few technical issues with that right now, but hopefully we will be able to bring that to you. Additionally, we want to make this access to insight as interactive as possible to help tailor some of the content to you on the fly, which is going to involve a little bit of audience participation. Now, don't worry, this will all be very anonymous, and don't worry if you're wearing slippers and pajamas, it's okay, because this is all going to be anonymous, but we're going to take a couple of polls of our audience, and we're actually going to do the first one right now. So popping up on your screen should be a survey. And we're asking you 3 questions we'd like you to answer, which will give Cindy a little bit of a sense of who you are and why you're here. The first question just asks, do you have kids at home doing online learning? The second one is, how is that experience for the students? And the third one is, how is that experience for you? Which is 2 very different things. So I can see some of the answers are coming in, and that's awesome. I'm going to give everyone else another minute, and then we'll review the results. And if you've just signed in, we're taking a poll to learn a little bit more about our audience, and which will help Superintendent Cindy Marten understand who you are and what's going on. I also want to acknowledge that our geographic area is bigger than the San Diego Unified School District. So we will maybe be learning about things going on outside of San Diego Unified School District as well. So this is great. I can see there's a lot of votes coming in. We'll give another 30 seconds or so, and then we will publish those results and take a look at them together. Okay, so we have a good percentage of the audience who have filled out the survey. That's great. So let's take a look at the results together. Now, Cindy, can you see those? Okay, well, I think I can't see them. Okay, I'm gonna hit share so then we can all see them together. So the first question is, do you have kids at home doing online learning? And actually the answer is yes, by the majority of people, 63% have kids at home doing online learning. The second question was, how is the homeschool experience for the students? And the good news is that about 50% are saying that it's very or somewhat positive. Some are saying it's neutral, but a minority, and only 1 or 2 people are saying it's a negative experience for the students. And how is the homeschool experience for the adults? That gets a little bit more all over the place, but it's actually still more positive than negative. So that's a very interesting kind of sense. So we have a lot of parents or people looking after kids doing online learning on the call, and they're having pretty good experiences so far. The students having very good experiences, and they're having okay experiences.
Can you scoot it up? I can only see the student one. Are you showing it?
You can scroll that. I think you may be able to scroll that.
Oh, there you go. Okay, got it. Usually when you share screen, you can't do anything with it.
Everyone at home can do the same, actually.
Thank you.
So I will leave that up there for a second. And I'm very grateful for everyone for participating. And that's obviously a great starting point to introduce Cindy Marten, our featured speaker. As you know, Cindy is a highly respected educational leader who has dedicated her career to public education in the San Diego region. As a teacher, instructional leader, and principal in Poway in San Diego, she developed a deep understanding of what it takes for schools to be successful. Since 2013, she's led the San Diego Unified School District as district superintendent to near universal praise. As the district superintendent, Cindy leads the district team and a community with a singular focus on student success. She believes that there are no excuses when it comes to providing children with the very best conditions that will enable them to become confident, successful learners who can achieve their dreams. In addition to a number of academic awards, Cindy has received a local Peacemaker Award, the San Diego County Bar Association Service Award for Distinguished Citizen, and my favorite, San Diego's 10 Cool Women Award from the Girl Scouts of San Diego. Cindy was very well received last year when she spoke at the Jewish Women Foundation's annual lunch, and so we're delighted to have her back. So I'm going to switch the view so make sure everyone can see you. And I was wondering if Superintendent Marten, you'd be willing to start by just providing a brief overview of the scope and of the challenges the school district has faced in going remote.
Okay, well, thank you so much for having me. And I really think it's awesome that you're putting this together to bringing in thought leaders and the kinds of things people are thinking about right now. So I have to start with saying hi to my mom, because I'm looking at the participants. And so I know my mom, Fern Siegel, is watching. And I'm so proud of my mom because she's totally got Zoom figured out and she's Zooming to all of her meetings and staying healthy. So to my mom, and I know Cecile Jordan, I see you, and Shayna. I've got like my mom, one of my former students, one of my former colleagues, Joyce, nice to see you here. And if I've missed somebody, I was just trying to quickly look at the participants, but this is a really big community. I think I heard Zach Patterson was also joining, so he might be on, but I don't see his name. Zach Patterson is one of our student board members, is our student board member, who was just elected. So I hope Zach is on here as well. So it's nice to be able to address everybody. And just overall, I think what I need to start with the scope of the challenge, I think is the way, Ollie, that you framed the question. The scope of this challenge from an education perspective has to be put in the context of the worldwide perspective. So in 188 countries worldwide, they've seen countrywide school closures, let alone all of the other impacts around the businesses closing. And when you look around and see the houses of worship and the libraries and the parks and so many things that we count on and that we go to regularly are closed. And so it's not just a San Diego problem, it's not just a California or United States, it's really worldwide. And the impacts are far bigger than we'll ever be able to totally understand, especially right in the moment. So when you think about from an education perspective, this is the biggest adaptive equity challenge in my generation. And I will say in the history of public education, for us to, as San Diego Unified is the second largest district in the state of California, we're one of the largest districts in the country. And I could talk about the size of the district and who we are we're one of 42 districts in San Diego County. So many of you on this webinar might not have kids in our system because I know that there's 42 districts in the county. And when you think about what we had to do on March 13th, we made a very difficult decision to close our schools. And that decision was made at a time when there wasn't clear guidance. On March 13th, there wasn't yet clear guidance from our state or local health officials, and the health guidelines weren't clear yet. There had not been community spread yet. There had not been known cases yet. And yet we knew where this was heading, looking at all of the other research and the other statistics that were coming in from other countries and other states at that time. So we knew when we made that decision that we were going to close to flatten the curve and to help with the community health guidelines that we knew were going to be so important. At that point, that was one of the toughest decisions you have to make. And as a lot of you on this call are leaders, and you know that leaders sometimes have to make decisions sometimes when there isn't a clear path forward and there isn't clear guidance and there isn't a black and white answer on what you're going to do, and yet you have to make the call. And so two things right up front that I knew needed to happen is that our district would need to ensure a continuity of two things. The food and nutrition services for our students, many of whom, over 60%, are dependent upon school. for their meal and nutrition services. And we could not see one day gap in that. If schools were closed, how would we ensure continuity of nutrition services? And the second thing, and I can't say that these are in order of importance more than the other, they're both important, but the second one, of course, was the continuity of learning. How can we fulfill the hope and the promise of public education, which is fundamental to our society, fundamental to our children being able to reach their dreams and achieve in their future? How do we continue when schools are closed? So we're physically going to be closed. How can we provide a continuity of learning? So those are the two big adaptive challenges we were going to adapt. We weren't going to change who we are as a district and what we believe in around equity and making sure that every student has, we've always defined equity in San Diego Unified as each and every student has what he or she needs when they need it in the way that they need it. That's what equity sounds like and looks like in real practice. Even when we're open, brick and mortar, schools are open physically, well, we need that challenge to then be addressed when our physical buildings are closed. And so if you can imagine, I think our district had two really strong legs to stand on to walk into this crisis. Number one, thanks to many years of investment from the San Diego community into public education through 3 successful bond campaigns, we have infrastructure around our district, both with the fiber optic and also with our computers and computers for students to use while they're learning. We have a device for every student in our classroom, and that's not new. That's not like, oh, there's a pandemic and we need to buy a bunch of computers so we can move to a remote distance learning format. That's something we've invested in for over 10 years. So our teachers and our students have been used to using digital tools for their learning in their classroom. What we had to do is figure out how to harvest those tools, the Chromebook computers specifically, from all of our classrooms, over 5,000 classrooms, and set up distribution centers so that kids could go and pick up their computer, have it properly cleaned and properly checked out to them with all the information about how to log in. So if you can imagine just the technicalities of 50,000 computers getting sent out to kids through 8 distribution sites, that had to get up and running right away. And then the same thing with the meals. How are we going to make sure that the meals are going to continue? So we partner with Feeding San Diego and with the San Diego Food Bank as additional support, but the district is providing the support of giving our students a breakfast, a lunch. We started with a breakfast and a lunch, and then we've added now weekend meals, and now we've added dinner service, and we're continuing to add food services to our students, and we're almost to the point of 1 million meals served. We're at about 900,000 meals have been served since we started our meal distribution center. And Jewish Family Service has been a great partner, has been helping us with the volunteers. We have our staff working on this. Obviously, the food service workers are definitely on the front line. When we talk about the home and the hospital workers and the nurses and the doctors are on the medical front lines of this. But what we're talking about from food services is our food service workers and team that's been distributing either the devices or the computers are the critical links for our community. So from March 13th, the day we closed, to that following Monday, we were up and running. We stood up our food distribution services on day 1. And for the first 10 days of the closure, the continuity of learning was set up through a partnership with KPBS, Public Broadcasting. They've been a great partner. That was something to put up right away through television access. And then we also put up lessons online for people to access for those first 10 days of the closure. Then we had a week that was our spring break. And then we started what we call our soft launch into distance learning. We knew we needed about 3 weeks to get our teachers ready, get the computers distributed, and get ready to start with our grading policies. What would this all look like? So during a 3-week period, we call that the soft launch was making sure that we could connect to our students. We always say, if you can't reach them, you can't teach them. We say that in the classrooms, which gets to a question I'm going to get to soon around mental health supports. But if you can't reach somebody, you can't teach them. Well, we mean that quite literally. And so we had many students that did not have access to internet. Cox Connect to Compete worked with us through Cox Cable to extend free internet service for 4 months to our families who qualified. Spectrum did, so every company did a little something to help us. We also had to purchase 5,000 hotspots. We had students in homeless shelters that we were able to go and find, make sure they got their computer in the homeless shelter, make sure they got their hotspot. So in that 3-week period, we were finding and reaching and getting kids to connect, to make sure you got your computer, you can connect, your teacher's been trained. In that 3-week period, we did over 13,000 hours of professional development of our teachers, over 500 professional development sessions to teach our teachers how to move to a remote learning format. And after the end of that 3-week period, we were able to say 95.6% of our students were able to log on and connect with their teacher, log into the district's Active Directory and get started with their learning. And now we're 2 weeks into our formal distance learning with our board, passing our grading policy. So, I mean, the level of scope and complexity is massive. And I just gave you some big high level numbers. One of the online platforms that we use to interact, it's a platform, this platform, Zoom, we logged on the within the first week of distance learning, 2 million Zoom minutes, meaning that's how much people were engaging in their learning using this as one of the platforms. And there were several other platforms that we use as well. So what I want to be clear about is, although we are closed physically, our school campuses are closed, we are very much open. We are open for learning. We say open hearts and open minds, and we want to be very flexible and act with wisdom and grace, understanding that our children are in incredibly stressful, vulnerable, challenging situations. And families who before this crisis would have said, we're good, we don't need a computer, they're coming to our distribution sign saying, oh my gosh, both parents are home working, and they have one family computer and 3 kids are doing distance learning. So you see a family coming and picking up 3 of our Chromebooks because every student needs to get ready for their distance learning. So size of the challenge is immense, and yet the commitment has never been more clear. Our commitment to equity, when I said we're going to get this done, we're going to get it done, not for the kids where it was easy. There are families where it was pretty easy for them to make this shift. It's not easy for anybody, I'll just say that. Families are very stressed right now, with parents trying to work from home and kids trying to learn from home. But if you think about a family who's homeless, or a family who was a low-income family is now a no-income family, and they really don't know where they're getting food or paying their rent, let alone getting online for learning, we wanted to develop customized supports like we do every day for our students to be able to be successful. And I say that this pandemic significantly changes how we operate, but it doesn't change who we are. And it doesn't change our belief systems about serving each and every student. And the challenge of serving each and every student in this crisis is immense, and we're up for it. So San Diego Unified had 2 good legs to stand on walking into this. One was our big investment. We already had the computers. And the second was our commitment to equity and professional development. Stanford University, the Learning Policy Institute, had just recently published a report about our district saying that we are beating the odds. They called us a positive outlier district because of our commitment to equity, and the kinds of results that Stanford found in San Diego Unified were called beating the odds because the kinds of things that were happening in our district in terms of academic achievement were beyond what you would expect given our demographics. So typically you can look at the demography and you can of a student population, and you can determine their academic destiny and frankly their destiny in life. We are about interrupting those kinds of things and saying your demography doesn't determine your destiny. And so that LPI report, Learning Policy Institute, validated the district's commitment to equity has already been proven to have closing the gap type results. And so that gave us a foundation to meet this challenge, and the technology gave us a foundation to go full into this approach and figure out how to make it work for each and every student.
I mean, when you talk about it and frame it in those terms, the scope of the challenge and the results you're getting, that's really incredible. We've been getting a lot of comments and questions in the Q&A, which we'll get to later. But like, I'll share one right now where somebody said you are polling a well-resourced group, so it's not surprising that you would see positive responses. Many families are not in the same position. I think that's the point that we take very, very well and is very true. And then we got some questions about the most under-resourced students. And I'll share that I was talking to a nonprofit yesterday called Nile Sisters, which supports refugees and other immigrants trying to adapt to life from some of the hardest places around the world who've come to the US. And some parents were afraid to accept the Chromebooks because they were worried that if the Chromebooks broke, they would be responsible for the cost of that. So, I mean, obviously that's an outlier situation, but the further you go down these sort of, in terms of being well-resourced for the students, the harder it is for them to be able to actually participate in meaningful learning and, accessing meals. So how are you trying, I think the statistics and what you've talked about is pretty incredible, but how are you trying to reach those most under-resourced students? And I guess my related question is, what are the long-term anticipated impacts of this kind of stretching that's happening right now?
Yeah, and while you were saying that, hi Shana, I see your questions and I see Marcia's questions too. So it's really important that just giving the students the computers and making sure they were connected to the internet. That was a big challenge even for our students that, 6,000 students in San Diego Unified experience homelessness on a regular day, and many more are probably moving into that category at this point. The stressful situations are very present right now. And so our key word, just even in the MOU with the teachers union that Ms. Sutton, Marcia just mentioned, and then Shana, what's really important is that flexibility was a key word. So we found out right away there was a whole group of families that were saying, we don't want to use the computer, we're against computers, we're afraid of computers, we don't want this, but how does our student keep learning? And the families, one of the things we had to do was increase our translation services, because now we're having to work with families that making sure that we can communicate with the family at home even more than we normally do. And so we have 138 languages, and teachers have at the ready, because of the increase in the translation services contract that we have. Now any teacher that needs to connect with a student who they're not able to speak the language at home and they don't want to learn on a computer, we now have hooked them up with a translator in any one of the 138 languages that they have. And we're customizing for those students a learning plan that works for them. So this idea that it has to be flexible, how do we make sure that it's flexible to the current need and crisis and challenge and vulnerability that each family has? And how do we make sure that every student's participating? We can design the very best plans and get the connectivity and have the teachers ready to do it. And yet, if it's not working and they're not participating, then that's not going to be, just like in brick and mortar learning, that's not going to be the fault of the student. We always say the farmer doesn't blame the corn when the corn doesn't grow. As teachers, when a student's not learning and a student's not participating or hasn't connected, that is not the fault of the child. That is the responsibility of the district to connect to that child. And that's what we're doing, is we're connecting to each and every student and finding out what is preventing them from participating in what we've designed. And some teachers have over-assigned things and made things too stressful for a family. Some, it's not enough and they need more. Some families are saying, I want 6 hours worth of work every day and I want them on the computer the whole time. And we're saying that's not best practice to have somebody on a computer for 6 hours a day, but we want to make sure that there's rigorous work for those that are ready to do it. And the other side of that is we don't want to stress somebody out with overly rigorous work if that's not appropriate for their current condition. And so one of the things we're tracking, besides the distribution and the did you get your computer and were you able to log in, that was sort of the first round of did we find you and are you connected? And we're getting close to 96% on that. Now what we're tracking on a weekly basis is participation. How are you participating? And teachers are reporting back to us. You don't do attendance anymore. You can't do attendance like you do in the brick and mortar. So it's a different way that we're doing it, but we are now tracking participation and tracking for over a 90% participation rate as well. And Shana, you're right. Is it meaningful participation? Are they accessing their meals? Once we went to the distance learning and all the teachers were back from spring break, we were able to unpack all of that and see that there was connection there. Oh, and the learning gap. Shana, do you want me to answer these questions I'm seeing?
I mean, listen, this is pretty interactive. So I was going to moderate it, but you were doing
I kind of,
Great.
I can't promise I can keep doing it this well because I do Facebook Live every Monday at 11, and I get really good at answering the questions, and then they start coming in and I can't catch up to them. So if I miss your question, don't take it personally. I will answer everything. I'll get things back to you. I'm more than willing to get to everything as quickly as I can, and that's what Ollie helped me if I haven't been able to do it as proficiently as I should. But Shane is asking another important question about the learning gaps, and we call it learning loss. Right from the very beginning, we submitted part of our advocacy to the state was the specific costs that are connected to specifically this pandemic. And at this point, we're talking about $30 million worth of costs. And one of the costs is looking at, the 30 million isn't even including this one. So 30 million, and actually my mom will smile about this because my mom's a CPA, and she was drilling me down on, so how much is this all costing you? And I had to have it make sense to my mother. So if I can make our financial obligations to this make sense to my mom, the CPA, then I can make it make sense to the Department of Finance up in Sacramento. But one of the costs we're trying to calculate at this point, which would be speculation, but would be about learning loss. And at one point early on, we thought, are we going to need to do some type of summer learning? We didn't know in the very beginning how long this was going to last. So we started calculating what would happen if we extended the school year. We don't know exactly the best way to make up for the learning loss at this point, but what we're looking at nationally, both at the national and state level, is any norm reference test probably has to be renormed because the norms are different now. When you lose 56 days of school, which is March 13th to March 13th to when school would have ended, even with distance learning going, it's not the same quality. It's not the same type of learning that we would have had. And so the way we address learning loss is first assessing what is the actual learning loss, what has been lost. Each teacher is in the process of doing that now. We're having to finish out this school year by compacting the essential standards, and that's work that teachers are used to doing, is lifting up and understanding essential standards at every grade level to make sure that critical course concepts are covered. I don't like to say that we cover curriculum. I like to say we actually teach it, but that's just the way people usually talk about it. So we want to ensure that we're doing all of our formative assessments and seeing how kids are doing during this time. And then when we come back in the fall, or I don't even know how to say come back in the fall, what that's going to look like. Everybody's saying, when are you opening again? What's it going to look like? Is it going to be hybrid? How long does distance learning have to go? I can get that question right away. That those answers are not yet known. I just finished a phone call with the 42 superintendents in the county and Wilma Wooten, our local health authority, and there is not an answer for that. We return to school when it's safe to do so, and the opening plans, the federal guidelines, the state guidelines, the local county health guidelines are all based on very clear critical health indicators, and folks are not going to want to send their children back to school unless they know it's safe to do so. But in that environment, we do have to address the learning loss, and we will have to have our teachers assess what kinds of gaps have been created during this time and what are the plans that we'll put in place both during school time and if we need enrichment time or added time for kids to make up the loss. We're actually quite expert at learning loss. Usually the learning loss is because of other extenuating circumstances that our kids are in. So when our kids are challenged because of family situations that have to do with poverty and challenge and struggle that they come from, we're used to having kindergartners who come in that are behind than other kindergartners, and we're used to closing that gap. Their reasons for being behind are different then, but that's up to us to be able to do that. Now we're going to have far more kids that we'll have to quickly assess where are the gaps, and then how do we address those gaps as in a way that makes sense. Shana, you're so sweet. You said, I so appreciate your leadership. I wish I could see you. You know what I hate about this, the webinar thing, is I can't see people.
All you're doing is staring at my face, and I'm sorry about that.
Well, you're giving me some visual cues, but actually this is the whole point about distance learning. I think you're going to get into the social emotional part of it. It's very hard to create community in a situation like this. So
yeah, so I'm going to ask you well, I'll break it down into different parts, but I mean, just generally, what are you seeing in terms of mental health implications for children staying at home? And then I think the well, we'll start there, and then I got 2 follow-ups.
Okay, and these are all near and dear to my heart. I see Joyce has a question about special ed, so we'll get to that. But so the first thing was the mental health support. So again, my mom's on watching, so hi again, Mom. Mental health and special ed are both personally very important to me. I know when I addressed the Women's Foundation about a year ago, I talked very, very much about my personal story and how I grew up here in San Diego. I attended San Diego public schools for elementary and middle school, and then I went to La Jolla Country Day for high school, and then I taught at Beth Israel Day School for my first 7 years. That's where I met Cecile. Hi, Cecile. I see that you're on the call too. And so when you think about mental health supports, I'm going to go back to something more personal here. My sister Laura, and I know a lot of you know my mom, and my mom's active in the mental health supports in San Diego, and it's because my sister Laura was diagnosed with paranoid schizophrenia when she was in her 20s. And then I'm just tearing up a little bit because she recently passed away, so I don't want to make my mom upset. But when I think about mental health, I'm not only talking about what my experiences are with my sister, but I know that our families right now are in an incredible amount of stress and an incredible amount of challenge that they're facing. And somebody who didn't already have a mental illness that was already diagnosed, see, I have to get my little tissue. They're going to have something now, and it's something situational, and it's something that's been caused by this current crisis. And so I want people on this webinar to know that from day one of this, I can talk about the computers, and I can talk about the meals and the distance learning, but if we don't have front and center our approach to this being a way that meets people where they might be in their struggle for mental health, then we will be missing something important. We can get the best distance learning plans up and running, and we can do the best that we can, but we have to make sure that we have these supports and that we recognize what our kids are going through. So I will have Ollie provide to you what our team has developed in terms of mental health support. I'm incredibly proud of what we've developed in terms of what needs to be out there for our families. So we have mental health resources for our families and mental health resources for our students. And we can't pretend we're not the mental health provider. I mean, we have to say that you need to get professional help if you need professional help, if you need your medications. All of those things are part of what the professionals need to do. But we know that kids not having access to education, and Marcia's question a little earlier was, are we seeing, by having a window into children's homes, are we noticing things? Are we seeing abuse? Are we seeing neglect? Are we seeing a student who's usually bright and bubbly and totally fine, and they log on and they just don't look right? When we see a warning sign like that, and yes, Marcia, we are seeing those things. We are still mandated reporters, and we're seeing things that we wouldn't have normally seen, both good and bad. And when we have a window into the lives of our children and the families and the stresses that they're feeling, our counselors are full-time on board right now and working full-time. Our school counselors and our partners who help us with mental health support. So when we see somebody unraveling or somebody disconnecting emotionally, and they're just not themselves, or somebody who was already diagnosed with a mental illness, that their supports are solidly in place, which goes right into the special ed and how important it is that the special education services are front and center. And that's also near and dear to my heart, that if we were going to do this, and I guess if we had no choice, we had to do it. But I knew that doing this meant it had to work from a mental health perspective, and it has to work for our students with disabilities because of my brother, Charlie. My older brother, Charlie Cohen, is developmentally disabled, and he grew up in San Diego Unified. My mom must have gone to 5 million IEPs for him. So I understand challenges for students with disabilities, and I can only imagine. My mom and I, by the way, talk every night. Doesn't matter how long my days are, and my days are very, very long right now. I always do my check-in every night with my mom. Thinking about what's happening and the challenges that are going on with our students right now, our students with disabilities. Even my brother Charlie, his whole living situation and the supports he's getting as an adult with disabilities, their service providers have had to completely change what they're doing. So I knew that the promises and commitments needed to be ones that would work for our students with disabilities. So all of the case managers and the related service providers, if you think about how we're providing supports for kids in brick and mortar, it has to look very different in this kind of setting. I skipped over some mental health stuff. Ollie will send for you our resources for mental health. We have, I feel like I have to say on this call, if anybody's that we have the crisis text line, we have substance abuse mental health services line, the Trevor Project, the Child Mind Institute, and the National Traumatic Stress Network. So we're actually partnering with lots of organizations. And then we've given good links to meditation practices, some of our apps and our tools that we use. We're making those free to our families. And these are apps that help with mental well-being and mental support. One of them is called gritx.org. It's an interactive website that lets adolescents discover, explore, get support. There's one called Mind Yeti. There's a YouTube channel for that. So there's dozens of them, but we've curated the very best mental health supports, tools, and resources. Some are emergency 911 practically calls where there's a live person on the other side where phone a friend, I need help now. And some are more, I'm not in crisis now, but I want to do something so my family doesn't get into crisis. So any manner of support is there. We're working with the American Psychological Association and all of the key partners to make sure we've put really good supports out there. And that's for our students, for our families, and then we have a whole section for our staff, because our staff is also, I'm worried about employee well-being during this time, and how are we giving our employees access to supports for them to stay strong. Many of our teachers have their own children at home, their own family members that they're taking care of, and then they're setting up their home virtual classroom to teach their students, and it's an incredible challenge that our families are facing. So I can give you the links to students with disabilities. We have the website that outlines everything we're doing for our students with disabilities, and the website that outlines everything that we've put together for our mental health supports. And I'm sorry I teared up a little bit, but these things are very personal to me. It's my sister and my brother are in both of those categories, and I cannot be leading a district that doesn't have very powerful positive intentions and supports around two of those critical areas for our most vulnerable populations.
Well, and I want to thank you for being that vulnerable, because first of all, it shows who you are and what you care about, but it also shows that like anybody who has any questions about your commitment to those issues, should have no questions whatsoever, because it's very clear how near and dear that is to your heart. And so thank you for sharing that. And we will make sure that all of those resources go straight out to everybody who is on the call.
And if any of my mom's friends are on the call, but you should text her right now, because I probably made her cry. Make sure she's okay. I know her friends are on here. I love you, Mom.
We're running a little low on time, so I wanted to make sure we at least got to the other key questions that we promised we get to. So
okay.
You touched on it, and I know you said, I don't know, but I would love to talk about your best guess for back to school. And I know obviously you are A, constrained in what you can say, and B, we don't know yet because we just don't have the data and we don't have good information, but what can you really share with us?
Was there, I'm going to ask this question, and I don't know if anyone knows, was there some old TV show like the $64,000 question? Was that a TV show?
The quiz show, yeah.
Was it called the $64,000 question?
I believe so.
Okay, so that keeps sticking in my head, and I'm going to rename the show. It's not the $64,000 question, it's the $325 billion question. And the reason why I just gave you that number is that is what our advocacy is at the federal level at this point for public education to not be completely decimated because of the COVID-19 crisis. And what we're looking at countrywide, the New York mayor, our governor, said that, I think it was the governor or the mayor, I can't remember which, but they both backed each other up on this, was that they're looking at potentially 50% cuts to public education in New York. Our governor, the Department of Finance just released numbers yesterday to the governor. The governor is required to release the governor's May revise on May 14th. He's required by law to do that. So we have a local, state, and federal level of advocacy on what it's going to take to not have education be the big, so many organizations and businesses and social services, everybody's in trouble because of this. But the trouble of having education be hit by this crisis because it wasn't properly funded to be stabilized doesn't hit us today. It hits us for an entire generation. If we lose a year of learning for our students because we didn't figure out how to fund this loss in revenue to public education, and we aren't able to open, it's not that we don't want to open. We want to open. We want to be back to whatever it was. I don't ever think we're going to be back to normal, but what we're learning during this time, as a lifelong teacher, I always say, once you learn it, you can't unlearn it. Once you know it, you can't unknow it. And once you see it, you can't unsee it. The lessons learned and the digital divide that's being closed during this time, I don't think should ever be reopened again. But all of that takes money. And so if we're talking about nationwide estimates from the Learning Policy Institute at 20% reductions in education, when much of the nation's workforce is in education as public school employees, we need to make sure that we don't radically destabilize public education because of this crisis. And so I have to say, Susan Davis, our local congresswoman, has been phenomenal. I have regular calls with her. I am so grateful for her support and the San Diego delegation to help us get our message to the congressional leaders that are writing the next federal package. That all of that has to happen. Here's the deal. We can't open until like 3 things happen. Number one, it's got to be safe. And when I say it needs to be safe, people will not send their children to school if they think their children are they're going to be at risk. We have 8,000 children who have asthma. We have thousands of children who are considered medically fragile, and we have thousands of employees that are in the over 65 age group. So if you think about, we have that alone, even if we could open with the health authority, how do we make sure it's safe? Do we have to have temperature checks? Do we have to socially distance the kids and put the desks further apart? Less kids can be on a bus together. Those are the kinds of things that we are talking about. I'm talking at the state and national level about what's going to be required to open and open safely. Because if you open it, it's not safe, it won't work. People won't come. You could be open, people won't come to work, and they won't send their kids. So we're talking about, when I say we, I'm not saying San Diego Unified, because please let me be clear, I'm not announcing any sort of big plan on this call, how we're opening, because the second thing that has to happen besides it being safe is we have to take our time to work with all of our stakeholder groups around how we're going to do this. And our stakeholder groups are our parents, our students. I don't know if Zach ever joined, but the student voice on this is critical. How do students feel about this? All of our employees and their perspectives and thoughts about how to safely open. So we have to be very collaborative and work in a collaborative way for all voices to be part of a vision around what's it going to look like. When I say fall, I'm just thinking the school year 2019-20 or 20 and 2020 school year is closing, and the next school year 2020 and 2021 will open and kids will be re-rostered into their new classes. How do we, when that happens, if we can't go back physically because it's not yet safe to do so, the third thing is all of the things it's going to take, and for us to agree on them together, it's going to take big funding. And I'm not talking about little funding. I'm talking about a major investment so that this generation's education is not lost to COVID-19. So I'm very clear on my advocacy on it's cost us $30 million to switch to distance learning. And now I'm pulling my price tag together on what it's going to cost to open and to open safely.
So that's why it's not a simple answer to the question of when are we going back to school. I mean,
I wish it were.
complex. I know that you have a 2 o'clock that you have to get to, and you wanted a few minutes to prepare for that. Do you want to just share a little bit about your Facebook Live? Because as you could see, we had question upon question upon question coming in, and I want to acknowledge that and apologize to all the folks whose questions we didn't get to. We got some by email as well that we weren't able to get to. But you have a Facebook Live?
Yes, I do Facebook Live every Monday at 11 o'clock. And that's why I'm getting used to doing this, but I do that every Monday at 11, and that's open to anybody. We're seeing our staff joins that, parents join that, kids join that, and my communication, I'm doing this by myself. Ollie and I are just flying solo on this call, but on my Facebook Live, my communications teams helps me with that. We're all working remote, obviously, but any questions that I can't get to in the Facebook Live, I go as quickly as I can. I have a topic usually that I present. I start with a topic that's sort of, what have people been talking about? The big thing people have been asking about is graduations and fall enrollment. And so depending on the kind of theme of what I hear bubbling up, we put all the answers into our FAQs. Those are updated daily on the district website. And then any topics that seem to be bigger, I'll sometimes bring a guest speaker with me onto Facebook Live, and it's topics from our parent organizations. What are the key things people want to know about? So yeah, that's every Monday at 11.
Great. Well, thank you so much. And I'd encourage everyone to go onto that to be able to submit their questions there as well. Our apologies for not being able to get some more questions. But Superintendent Cindy Marten, thank you so much for this really open, frank, candid, and transparent discussion. I really appreciated it, and I know our community really appreciated it. So,
is there any way you can make sure I get the Q&As, because I do feel badly. I'm trying to scan them quickly, and I can give you the answers later. So I don't want anyone to feel like they came here and I avoided them, because I'm open book. I'll share everything, and we just didn't get to them. The grading policy I see is one that someone wanted to know about, and and the therapy dogs. I'd be happy to get back to you on any of those.
You can also copy, you can actually just select and copy and paste all of that. And
okay.
I'll do the same as well, but just in case.
Oh, good. Okay, I'll do that right now.
Great. So thank you again so much. We're going to switch gears really quickly for this new segment we've put together. Now, we had some slight technical difficulties, so I'm hoping this is going to work. But one of my colleagues, Eli Landau, is now going to share with you a message from our CEO, Beth Cyril, that was pre-recorded. So Eli, hopefully this will work. Over to you.
Thanks, Ollie, and thanks, Cindy. We really appreciate your time to discuss that. Thanks so much. I wanted to take a minute to bring you up to date on what the Jewish Community Foundation is up to around addressing the needs of the COVID-19 challenge. We always work with nonprofit organizations to help them build their capacity, their fundraising, their governance, and the like. And now we're working a lot with nonprofits to help them apply for federal aid, brainstorming with them how to deal with their fundraising or expense cutting or anything it's going to take to help them survive this time. And in doing that, we get a real view of what's going on in the community. So I wanted to share with you a couple of things we're learning and then tell you more about what we're doing to address them. So first of all, no surprise, there are a lot of nonprofit organizations out there that were reasonably healthy a couple months ago and are now really cash strapped. And the same is true of individuals and families that in early March were reasonably self-sufficient and now are struggling to put dinner on the table. We know that there's been a moratorium on evictions and foreclosures, but we see that that debt will grow. If you don't pay your rent this month, eventually it has to get paid. And so we see that this debt is accumulating, and we're concerned that it could really be crippling to people as they hopefully go back to work. We also see the psychological pressure that not being able to pay your rent puts on people. We're seeing increasingly the traumatic effects of the isolation, the volatility, the uncertainty, just the scariness of this time. That's especially true amongst the elderly, but we see the trauma amongst children really across the whole community. I mean, there's no one who's not affected by this. And the last learning, most unfortunately, we do see a rise in domestic violence. And we're really hearing that it's going unreported, and that some of the nonprofits that we work with, they see it, but that doesn't mean that it's really being reported. And that's clearly a problem and probably will continue to increase as we're all at home 24/7. So what is the Jewish Community Foundation doing to address some of those needs? So first of all, between March 15th and April 30th, we made about 800 grants totaling about $8 million to about 200 nonprofit organizations in San Diego. And that is about 25% more in dollars than we did at this time last year. So we're definitely seeing that donors are stepping up, and we are working with donors to help them make the difference that they want to make to address these challenges. There is not a nonprofit on the planet that is unaffected by COVID-19. And so we're really helping people to have the impact that they want to have to help us all get through this. And I do want to say, if you're thinking about where you want to give and you would like some help with that and understanding, who's doing what, we have a team of people at the Jewish Community Foundation. It's their job to help you. And so I would encourage you to contact Ollie. You can email him at ollie@jcfsandiego.org, and either he will help you or he'll get one of our team to help you. So please feel free to do that. In addition, the Jewish Community Foundation has set up 3 funds that donors can contribute to, and we have a couple task forces that are working on really looking at the needs in the community, to make grants out of these funds. The first is a Jewish Community Fund, which is really targeted individuals and organizations in the Jewish community that are impacted by COVID-19. The other 2 funds address secular needs across the entire of San Diego. One is a public health focused fund around research, protective equipment, first responders, and the like. And the last is a vulnerable populations fund that is addressing the needs of individuals and families across the county who are unemployed and now facing some extreme hardship, putting food on the table and a roof over their head. And we are doing everything we can to raise resources and grant resources to those communities. I did want to take one final minute to update you on a few upcoming events, or to share with you a few upcoming events. On May 20th, that's Wednesday, the Jewish Women's Foundation will be having its annual meeting. It's usually a luncheon. Obviously, in this situation, it will be online, but Debbie Buchholz, who's the general manager of the La Jolla Playhouse, will be talking about the arts and how the arts are surviving through COVID-19. That's at noon. It's at 11 a.m. on May 20th. And if you would like a link to Zoom in for that, we are happy to provide that. And then in the next couple of weeks, we will be having a conversation with Robert Price, the head of Price Philanthropies, one of San Diego's preeminent philanthropic institutions. And I know that will be both an inspirational and informative conversation with Robert. So we'll be getting some information out on that as soon as we have a firm date, and we'll update you on that. And in the meantime, thank you again for joining us this afternoon, and I'm going to turn it back to Ollie. Thanks.
Okay, well, thank you so much for listening to our Access to Insight today. Before you all head off, I'm going to ask you to submit one more poll that we have, which I'm now putting on the screen, and we would love your feedback. We want to make this more interactive in the future, and we want to get your feedback on how these surveys, how these Access to Insights are going, whether you are finding them informative, and how we can make them more informative. So I would be really grateful if you would stay on the Zoom for one more minute just to fill out those polls or that poll, and we will take that feedback and make this service even better for you. So while you're filling that out, I will say thank you once again to Superintendent Cindy Marten for an incredibly meaningful presentation, to our CEO Beth Cyril and our Director of Finance Eli for at the last minute helping put that video up and available for everybody. And to our audience for your interest in the community and the work of the Jewish Community Foundation. When you have finished taking the survey, you can feel free to drop off the call. But on behalf of the Jewish Community Foundation, I want to wish you all a Shabbat Shalom and a very restful weekend. Thank you so much for joining us today.